Yeah. Hi, Ashrafji. This is Dhruv here from the technical team. Am I audible?
Yes, yes, sir. You are audible.
Yeah, yeah. So can I make you the host of the event once it is started?
No problem, sir. You can.
Yeah, yeah. So you can end it from your side. Is it fine, sir?
Okay, sir. No problem.
Yeah. You are sir ASM, right?
Yes, sir. I am SM, sir.
Yeah, yeah. So I'll make you the host. And once the event is done, you just need to click on the end button. So the event will be ending. I'll leave the meeting as it is Zoom meeting. Is it fine, sir?
Fine.
Thank you, sir. Thank you so much. Hello.
Hello.
Yeah. Yeah, Mohammed ji. So end button na
Yes, sir.
the end button is once I make you the host, you will where you will get the leave button, na, there you will get the end button. You are
Okay, sir.
co-host now, I'll make you the host.
Okay, sir. Okay, okay. Sir, good evening.
Good evening.
How are you, sir?
Fine, thank you very much. How are you?
Fine, fine, sir.
Good.
Sir, 5, 6 doctor have already joined, sir.
कोई
Within a
बात
5
नहीं, जब
minutes,
तक
sir.
लोग आते हैं आराम से ज्वाइन करवाओ. There is no urgency.
Okay, sir. Thank you, sir.
You will be giving me the slide share rights, or you will be.
No, no, sir. You will.
Achha, I'll do my own. I'll
Yes,
predict
sir.
my own. Fine, fine, great. Kindly wait for a moment.
Okay, sir.
Sir, we can start with the session, sir.
Hold on for a moment.
Yes, doctor, you are audible and visible clearly. We can start with the session.
Can you all see my slides?
Yes, sir. Yes, sir. It is visible,
Am
sir.
I visible and audible?
Yes, sir. You are visible and audible also, sir.
Anyway, thank you very much for inviting
Sir,
me to this August
sir,
gathering, and I welcome you all.
thank you, sir. Sir, just wait for a minute, sir. I will just give brief introduction of yours, sir, and after that you will start, sir.
Fine.
So good evening, everyone. Greeting from Dr. Reddy's laboratories. I am Mohammad Ashraf, working as ASM in Delhi, and I am hosting today's digital CME. Thanks to all for being present here for ERTM on current challenges in management of RTI and emerging trend. We have with us our elite speaker, Dr. S.K. Gupta. Dr. S.K. Gupta has been practicing as a consulting physician for more about 30 years. We all know that Dr. S.K. Gupta is senior consultant, and also Dr. S.K. Gupta is teaching faculty of medicine at Chaudhry Charan Singh University, Meerut. He has received his MBBS and MD degree from Maulana Azad Medical College. His area of interest lies in COVID, diabetes, and hypertension. His early morning COVID update has been very popular across India and abroad. He has many publications in national and international journal. He has got Chikitsa Ratan Award in 2005. Dr. S.K. Gupta referred to as one of the most renowned consulting physician in Delhi. Welcome, doctor.
Thank you, Ashraf. Thank you for this kind introduction. And I, Dr. S.K. Gupta, welcome you all to this wonderful meeting. And the topic for today that has been assigned to me is the use of azithromycin. And azithromycin is one drug which we have been using for last several years. To be very frank, azithromycin is as old as our practice is. Azithromycin came to use in general practice in 1988. Though it was discovered in 1970s, but it became available for the use in 1988. And I had completed my internship in 1985. तो 1988 से लेकर के अब तक हम ये दवा यूज कर रहे हैं, यानी कि हमारा जो दवा को प्रयोग करने का अनुभव है वो लगभग 25 वर्ष का अनुभव है। अब आप ये कहेंगे कि 88 से लेकर के और 2022 तक तो लगभग 34-35 साल हो जाते हैं। इनफैक्ट जो मेडिसिन थी वो मार्केट में अवेलेबल तो थी, बट इट वाज वेरी एक्सपेंसिव। सो जो वाइड स्प्रेड यूज हुआ दवाई का वो 1997-96 के बाद शुरू हुआ, when the drug became available to everybody and we started using it left and right in our practice. And since then till today, I feel it is one of the most prescribed antibiotics and is also one of the antibiotics which have never failed, at least to me, in the clinical practice. And azithromycin is one drug which is available in the tablet form. It is given as a single tablet. It does not have any side effects. And the drug is easily available and it is affordable to most of the patients. It is widely used in all age categories, including the neonates, the children, the infants, and the adults and the old age people. The drug there's a wide spectrum of activity. Drug was widely, basically initially it was prescribed for the gram-positive bacteria. But now the drug is being, the use has been extended to be used in typhoid fever, and even in cases of malaria, the drug is being used. So we will be talking about the use of the drug in various infections, and today's topic will basically fan around these headings. One is the prevalence of infectious diseases, the treatment of upper respiratory tract infection, typhoid fever, and the COVID-19. And then we'll go into the details of the upper respiratory tract infection, typhoid fever, acne, COVID-19, and severe asthma. I think one thing that gets missed in this list is the sexually transmitted diseases, especially by the chlamydia, where also the drug azithromycin is very, very effective. And now let us first go into the details as to what is the burden of disease, that is the prevalence of various infective disorders in a clinician's clinic. And we find that the infection, among the infections, जैसे कि आप सब लोगों को मालूम है कि upper respiratory tract infection, यानी कि जुकाम, खांसी, one of the most common infections in the clinical practice. आप सब लोगों को भी देखने को मिलते हैं और हम लोगों को भी देखने को मिलते हैं। इनफैक्ट चाहे वो किसी सीनियर कंसल्टेंट का प्रैक्टिस हो या किसी जनरल प्रैक्टिशनर फैमिली फिजिशियन की प्रैक्टिस हो, I think it is one of the most commonly encountered infection in the clinical practice, which is there and which is the most common infection. And then we have the lower respiratory tract infection, which is around 8%, and the upper respiratory tract infection forms around 13% of the total practice patients that come across. And from clinic to clinic, it may vary. And we find that the global burden of disease is not that it is so high in India, it is also there in the Western countries, but the infection is much more higher in the Indian subcontinent than in the UK. Here in India, we have 15 times higher than in the UK. And now we come to the typhoid prevalence, and you all know that you must be seeing the reports of the Vidal test left and right and diagnosing typhoid fever. It's much more common in the children less than 5 years of age. It is also pretty high in the children between 5 to 19 years of age and slightly, and the prevalence is of 110 patients among 1 lakh patients in 20 to 40 years of age. Why is it that the patients who are older, they have less typhoid than the patients who are younger? Because of the immunity which develops to the infection over the period of time as the age goes on. Now we come to the acne. Acne is one thing. All the ladies, beautiful girls, coming to you and requesting for some treatment for the acne, the pimples over the face, and the prevalence has been noted to be 0.75% in one study, and it is pretty common in the adolescent age group, or especially the early adult age group, that is 25 to 35 years of age, when the girls are to be married and they are really worried. डॉक्टर साहब किसी तरह से भी ये चेहरे के धब्बे हटा दीजिए, and they are much more common in the females, the prevalence being around 81%. And now we come to the COVID-19. COVID-19, the drug was widely used, Azithromycin, and you might say that the drug is effective against the bacteria, but it is how come that the drug was so widely used in COVID-19, and it is so highly prescribed that the drug companies, they raise the prices, and though luckily the drug was available all through. And this is the figure about a month back, and today as I see that the figure has crossed to nearly 4 crore 38 lakh cases and around 5,26,000 deaths of COVID-19 in India. The number of deaths have decreased, but the number of cases continue to increase because of the changed Omicron virus, which is much more contagious and it is fast spreading. But the mortality and the morbidity by the virus has gone down, courtesy the effective vaccines used in India and abroad. Now we come to the treatment of common infections. And you all know the sinusitis is something very common, the otitis media discharging ear. It is very, very common, and it has been seen that the drug, if it is given even for a short course, then the drug is effective, then the drug remains effective. And first line, the acute otitis media patient coming to you with the fever and the pain in the ear and some watery discharge or some serious discharge. The first line drug used to be amoxicillin, the high dose amoxicillin in 2 divided doses. And in case the drug was not effective, then you can shift over to sabdenil or azithromycin, first line dose antibiotic in those who have amoxicillin or the penicillin allergy. Acute rhinosinusitis, it is sinusitis is only one condition where only the sinuses are involved. When the nose is also involved, then it is called as the rhinosinusitis. Then the beta-lactamase is producing hemoptysis influenzae, and the drug of choice would be amoxicillin clavulanic acid, which is given 500 milligram plus 120 milligram every 8 hours for 5 to 10 days. But those patients who have allergy to amoxicillin or amoxicillin clavulanic acid, then we have to think of doxycycline, levofloxacin, and moxifloxacin. And these drugs are as effective as the amoxicillin, which is much more expensive drug and has a lot of side effects also. Now we come to the streptococcal pharyngitis or the streptococcal sore throat. Is very common. Group A is streptococcal pharyngitis. Group A and Group B, who are my colleagues who might not be remembering, it is good time to recollect that the Group A are the streptococcal pyogenes, which is a very common bacteria, and the streptococcal and then long chain cocci, and the Group B is Streptococcus alligati. And Group A is much more dangerous, and these are beta hemolytic streptococci. And for these streptococcal infections, the sore throat, which is very common infection in the OPD practice, and those patients who do not have allergy, the first line treatment referred in the books is the penicillin B or amoxicillin. Penicillin B is we hardly use these days, or the benzathine penicillin. None of us use the benzathine penicillin in our practice for the fear of anaphylactic reactions. So drugs left are the cephalexin, ciprofloxacin, clindamycin, azithromycin, and clarithromycin. So you find that this is the only one drug, azithromycin, which is recommended as a 5-day course, while the other drugs are recommended as a 10-day course. So in my clinical practice, this takes over as the first-line drug because the drug is given once in a day, while the drugs are given twice a day or 3 times a day, and at times 4 times a day also. And the drug is nearly much more affordable and available and very, very effective drug. Now we come to the enteric fever. For some of us, it might be a surprising thing that the azithromycin, despite being a gram-positive drug, can be used for patients with typhoid fever, which is caused by a gram-negative flagellated bacterium called the Salmonella typhi or Salmonella paratyphi. The first-line drugs, of course, the quinolones, that is the ciprofloxacin, ofloxacin, or third-generation cephalosporins like cefixime. In those cases who do not respond, then we come to the chloramphenicol. Chloramphenicol used to be the first drug, which used to be dispensed by the family physicians, but the drug still holds promise, and we still use the drug in a clinical practice when the patient does not respond. We do not use it as a first-line drug because drug is associated with the serious side effects of agranulocytosis. But those patients who do not respond to the cefixime or the ciprofloxacin or ofloxacin, we straightway go to the azithromycin or a combination of these agents. Those patients who have a complicated fever, that is those patients who develop hemorrhage, or those patients who develop signs of meningitis, meningism, or some encephalopathy, of course, then the third generation and the fourth generation cephalosporins, that is the ceftriaxone, cefotaxime, or ciprofloxacin, or a combination of these agents is the preferred choice. But the one thing which remains to be known, that the azithromycin can be a good choice in patients with typhoid fever, especially in combination with fluoroquinolones or in place of fluoroquinolones. Now we come to the acne. The beautiful ladies coming to the clinics and saying, "Doctor साहब ये pimples हटा दीजिए please." Or the mother coming with a girl, "Doctor साहब इसकी शादी है, जरा ये पिंपल हट जाए तो थोड़ा सा काम बढ़िया हो जाए." It is the drug of choice. It is recommended in the management of moderate and severe acne and forms the inflammatory acne that are resistant to topical treatment. That is, you have given the topical creams, that is Persol, or any other cream that you like, Persol Fort. Despite the fact that despite the application of these creams, the acne have not become all right, then you give azithromycin, minocycline, or doxycycline. Then using the tetracycline, oral azithromycin can be as effective in treating acne, and the simultaneous use of topical therapy with benzyl peroxide, retinoid creams should be used with systemic antibiotics. Now we come to the COVID-19 management, a specialty which is very dear to me. Patients in mild disease or patients with moderate disease, especially large number of patients, I think more than 97% patients of the COVID-19 could be treated at home. They belong to the mild category in upper respiratory tract symptoms of fever without shortness of breath. They were all counted as a mild disease, and the moderate disease was one which has a SpO2, that is a hypoxic symptom less than 94%. And in these patients, mild disease, we gave hydration, antipyretics, antitussive agents. But in cases of moderate disease, we might have to go for the anti-inflammatory or the immunomodulatory therapy. And despite repeated recommendations by the various authorities, most of the practitioners, they continue to use some antibiotic fearing the secondary infection, or we can say that the azithromycin is the most prevalent, the most widely used antibiotic in the patients with COVID-19. How did it help? We are going to discuss just now. But those patients who are admitted into ICU, a prophylactic cover of antibiotic was given by ceftriaxone, meropenem, or cefotaxime in most of the cases. Now we have the azithromycin, the various clinical uses. We are going to go into details of upper respiratory. What is the evidence of use in upper respiratory tract infection, acne, severe asthma, COVID-19, and typhoid fever. Now we come to the azithromycin in upper respiratory tract infections. Sometimes upper respiratory tract infection patient comes to us with a sore throat. We do not know if it is viral, though there are some differential features from the bacterial infection, but at times we may not be able to differentiate. Then the viral infection will basically lead to the conditions which will favor the bacterial invasion, and the bacterial invasion will lead to the conditions which will favor the immunomodulation and lead to the superimposed viral infections, which is common. Both are very the coexistent infections are not less common. So at times it might be difficult to differentiate whether it is a common, it is this isolated viral infection like adenovirus or respiratory syncytial virus, or it is a combination of streptococcal infection along with some virus. This is a study which showed that many of the pathogens which are found in the upper respiratory tract have become resistant to the commonly used antibiotic, that is the ampicillin, amoxicillin, ciprofloxacin, chloramphenicol, erythromycin, cefuroxime also, and gentamicin. And the rate of resistance was in some studies around 65%. Staphylococcus aureus becoming resistant to beta-lactam antibiotics. 46%, 26%. In the ciprofloxacin getting resistant, in the chloramphenicol developing resistance. Various pathogenic bacteria in the upper respiratory tract infection have become resistant to a wide range of commonly used antibiotics, as shown in this study, which was there with Bang et al. And was published in 2016 in Journal of Biotechnology. But the susceptibility of azithromycin against the selected upper respiratory infection pathogens remains, and azithromycin is effective even at a very low minimum inhibitory concentration, both against the gram-positive aerobes as well as the gram-positive anaerobes, that is Haemophilus influenzae, Moraxella, Legionella, Bordetella, and Chlamydia pneumoniae, Mycoplasma pneumoniae, and the Helicobacter pylori. See, the Chlamydia pneumoniae and the Mycoplasma pneumoniae are the very common infections in the pneumonia, and sometimes when we do not have adequate response using the ceftriaxone and other drugs, we switch over to the adding the azithromycin because it gives rise to a quick response. I think I can skip the slide. This is the study which shows that the azithromycin has a better response rate and upper hand in clearing the microbes as well as the clinical response, and you can find that the azithromycin 5-day course, the bacteriological eradication was to the tune of 95% as against 77% for the penicillin, and the clinical response was seen in 98% patients, while the penicillin would show the clinical response only in 87% patients. The use of penicillin over the period of time has gone down. When I was a senior resident in 1980s, I used to find that the most common drug in the world used to be crystalline penicillin, but now the use of crystalline penicillin is has gone down drastically, and the use of cephalosporins has definitely increased. And in the OPD practice, the erythromycin is taking over the other antibiotics because it is easily available, it is free from side effects, and it is affordable, and it is given once in a day. Azithromycin versus amoxicillin, clavulanic acid, and acute otitis media, that is the discharging ear. A patient coming to you with fever, pain in the ear, and discharging ear. And these are the various studies which show that the azithromycin was much better a drug in these in this condition, 82% versus 79%, 92% versus 90%, 85% versus 84%. These are the records of various systematic meta-analysis of the various trials, which show that the azithromycin is much better drug in all the age groups, 6 months to 12 years of age, and even beyond that. Now we come to the sinusitis, the evidence that the 3-day course of azithromycin versus 10-day course of amoxicillin clavulanic acid. 3-day course of azithromycin was as effective. See the difference. You see the words. 3-day course of azithromycin was as effective and well tolerated as a 10-day course of amoxicillin clavulanic acid. So, my dear friends, would you like to use azithromycin or like to use a 10-day course, which is expensive, which is associated with some side effects like diarrhea and causes a pill burden over the patient, while just a 3-tablet course by the azithromycin in patients with bacterial sinusitis. And this is the slide which is showing the evidence. Overall success rate with the azithromycin was 99%. And the success rate was similar across the subgroups of otitis media, bacterial sinusitis, and pharyngeal tonsillitis. Even the tonsillitis, the pharyngeal tonsillitis, sometimes the tonsils also get involved, the pharyngitis is also there. Otitis media can be superimposed, and there can be sinusitis also. And the success rate was nearly 100% among children and adolescents. And it was 98.6%. Really remarkable. It's a wonderful drug and still remains a drug of choice despite some resistance being reported. But in my clinical practice, I find that the drug is a miracle drug, which is literally free from side effects. Azithromycin in acne. As a patient comes to you with the acne, you all start going with the local treatment, the retinoids, and local application of benzoyl peroxide and all those things. But sometimes these patients, they do not respond, and the patient is started on oral doxycycline or oral azithromycin. Because the higher concentration level of drug in tissues compared to the serum level due to the delivery of the infection site by the phagocytes and the fibroblasts. Metabolization by the hepatic pathways other than the cytochrome P450, which lowers the risk of drug interaction. Bioavailability is very high after a single oral tablet with a half-life of nearly 68 hours. The drug azithromycin has a wonderful half-life. You give a 3-day course and the drug remains in the body for 15 days, 2.3 weeks. Wonderful. 15 days, sorry, 2.1 weeks. The drug remains in the body, but you just giving the shot, 3 tablets, and the drug acts for 2 weeks, nearly more than 2 weeks. It not only has the antibacterial activity, it has the immunomodulatory activity and some anti-inflammatory effects. And here are various studies which show that the azithromycin was well tolerated with a significant reduction in the number of lesions. Majority of adverse effects were related to the gastrointestinal and intestinal side. Sometimes azithromycin can cause diarrhea, but the drug is also used in the treatment of diarrhea. Sometimes it can cause nausea, sometimes the liver enzymes can raise, sometimes the heart rate can slow down, especially in patients who have low potassium levels. One has to be slightly careful in these patients. Those patients who have liver disease, kindly avoid giving azithromycin, but most of the other patients, they can be safely given azithromycin. And even azithromycin 3 times a week in patients with acne has been found to be very, very high. These are the various studies, and they say that azithromycin plus topical adapalene gel or topical retinoid, or they are all effective. And these drugs, the drug is also effective, plus azithromycin plus isotretinoin, which is available as oral preparation for the treatment of acne. So we have azithromycin, we have only the benzoyl peroxide, retinoid, the application agents, and we can add the azithromycin to these agents. And if the patient does not respond, then we can give isotretinoin 0.3 mg per kg per day for 6 months. And along with it, we can give azithromycin for 3 consecutive days in a each week for 1 month with a low dose. And the drug has a high cure rate of 94%. Of course, acne is something which is very difficult to treat because it is associated with the hormones and puberty. Sometimes you may not have, but the continuous long-term therapy might be required. And in case patient does not respond, a referral to a specialist might help. Of course, this is the drug. These are the slides of the studies which compare the doxycycline with azithromycin, and they show that both the treatment but same effective and similar improvements. But of course, doxycycline remains the first drug of choice as a matter of reflex. But in case you have started azithromycin with the tretinoin or isotretinoin, then you have done your job. The patient should improve. Now we come to the azithromycin and typhoid fever. Many of physicians, they start straight away with the ceftriaxone and cefotaxime. At the IV treatment, the moment they see that the bidar is positive, you can definitely give the trial of fluoroquinolones, that is ciprofloxacin and ofloxacin. And if the patient does not respond, you can add azithromycin. These are the drugs. These are the slides which show that the salmonella typhi has developed resistance to ampicillin, chloramphenicol, cotramexol, mellitic acid, and ceftriaxone. In these cases, the drug of choice remains azithromycin. And azithromycin might be, it is pretty surprising, but this is a drug which is not used so frequently. In azithromycin, sometimes the fever, we do not know whether it is typhoid fever, it is some cryptic infection. And I, at times, as empirical therapy, use azithromycin, and most of the time they have wonderful response. So what is the clinical response? And we find that the clinical cure rates were 62% with ciprofloxacin, 71% with cefixime, and 85% with azithromycin. The drug might be better than ciprofloxacin, cefixime, and azithromycin. And the fever clearance for the patients treated with azithromycin, fever becomes all right in 6 days, while it may take up to 7 to 8 days in patients. Because azithromycin has a direct immunomodulatory and direct anti-inflammatory activity. It also works like paracetamol. It is surprising. You might be surprising. These findings are surprising, but the drug has definitely good anti-inflammatory effect activity, and that's why the drug has been used in COVID also. I'm just going to come to it. Now we are coming to the COVID. The drug has multiple immunomodulatory effect. It leads to the inflammation, the inhibition of the pro-inflammatory cytokines. You might be getting IL-6 levels in patients with COVID-19. The drug has shown to decrease the effect of has shown to decrease the IL-6 levels. It has shown to decrease on many other immunomodulators like IL-8, and it has shown to increase the interferons, and it has decreases the neutrophil reflex, and induction of regulatory functions of macrophages and alterations in its autophagy. So it has multiple effects, and that's how the drug is effective in patients with various viral disorders, though it has not been approved by the various regulatory agencies, but our clinical experience and the experience of so many of our physicians and our priority towards the care of our patients, they compel us to use azithromycin in most patients of COVID-19, especially mild to moderate illness. And we might have designed our own cocktail, and the antiviral activity of both in vitro as well as in vivo on an array of viral strains, including the respiratory syncytial virus, Ebola virus, Zika virus, influenza virus H1N1, enterovirus, and rhinovirus, has been proved beyond doubt in patients using azithromycin. This is the slide which shows that the drug is effective. It prevents the entry of the virus, the cell, then it prevents the replication. because it acts on the ribosome. Then it increases the interferon levels. It decreases the chemotaxis and the ROS production, and causes inhibition of interleukins, inhibition of IL-6. And so it acts multiple ways in patients. And how does it act, we really do not know. But multiple actions, they ultimately lead to the improvement in good number of patients. I think this slide I can skip. Now, the latest evidence coming up, that is severe asthma. Patients of severe bronchial asthma, and the azithromycin has been advised, has been rather recommended for the global initiative for asthma. You all know that the global initiative, the GINA guidelines are followed word over. Global initiative for asthma guidelines, they have started recommending that the preferred treatment at step 1, but not in the step 1, at step 5 in the adults, adolescents, is add on azithromycin 3 times a week in patients who have persistent symptomatic asthma despite high doses of inhaled corticosteroids and long-acting beta-2 agonists. That is, you are using a combination of formoterol and the steroid, that is budesonide or fluticasone. Then these drugs, they can be used once in a week, 3 times a week. And this is a drug which might help the patient, especially the severe resistant patients who are not improving. And these patients, they might respond, and not me saying so, it is being said, it's being recommended, and the latest recommendations, they come from Global Initiative for Asthma. This is the trial which says that the eczema exacerbations reduced as compared to the placebo, and the response was significant improvement in the asthma-related quality of life. This is the slide which shows that when the placebo was given, this was the symptom score, and this was the eczema exacerbation rate when the azithromycin was given 3 times a week. So the drug is going to be effective and useful in patients along with the ICS-LAVA combination inhalation, and these patients might be given a better quality of life. So this is the take-home points. Progressive clinical and in vitro studies conducted over the years have indicated growing acknowledgement of azithromycin's broad spectrum pharmacological profile. Azithromycin is a broad spectrum antibiotic with immunomodulatory, inflammatory, and antiviral pharmacology. Azithromycin is effective and well tolerated in the management of bacterial upper respiratory tract infections. In acne patients, treatment with azithromycin is associated with significant improvement and reduction of lesions, safety, and compliance. Use of azithromycin in typhoid was associated with good clinical cure rate and fast physical credence. Due to its antiviral and immunomodulatory action, azithromycin might play a role in COVID-19. And on azithromycin is recommended by the Global Initiative for Asthma in the management of severe asthma. Thank you very much. And that's all for today. In case of any questions, you're all welcome.
Thank you, sir. Thank you very much for beautifully presenting the slides. I would like to request our audience, if they have any doubt, they can ask. I think, sir, so you have presented so beautifully that they have cleared all their doubts, sir.
I think they have, they are shy of asking some questions. And no, they should be all encouraged. They're all wonderful people. And,
yeah, no doubt, sir.
They have all roaring patterns. 2 or 3 small things which I would like to add on, that how do we use azithromycin. My first shop share, fine. In patients of any disease, how do we give azithromycin? Azithromycin should preferably give an empty stomach. The drug is very well tolerated in case patient has not taken anything for the last 1 hour. and he does not intend to take anything for 2 hours, then the azithromycin is very safe. Azithromycin is very safely given. And sometimes the physicians, even me at times, they have some doubt whether the azithromycin given for 3 days is going to work, because the patient is very serious, he has a serious infection, and we doubt whether the 3-day course will be sufficient and the patient might not relapse, symptoms might not come up again. But I just agree again, I emphasize here again that the azithromycin is one drug which is taken up by the tissues and stays in the body for a very long time of 15 days, and the drug is slowly released and remains and keeps working even if the oral dose has been given, has been stopped, and the drug has a very good long half-life of 68 hours at nearly 3 days. So even if you have given 3 shots of azithromycin, you should be assured the drug is going to work. The drug is largely free from side effects and is the most commonly drug used by me in my practice, the most commonly used antibiotic. Thank you very much.
Thank you, sir. Thank you for sharing your valuable experience, sir. So, sir, with your permission, can we close the session, sir? If
If there are no questions, you're all, you should say thanks to all the participants and promise them that they'll be invited again, and they should join whenever they're requested to do so.
Thank you, sir. Thank you very much. Thank you, sir. Thank you, all audience.